the holistic aspect is to try to prevent diseases long term.
What is integrative veterinary care all about? And how can it help your dog or cat, especially when dealing with cancer? Find out with Dr. Henry Pasternak on this episode of Tripawd Talk Radio.
Man scratching like a three-legged dog.
For any tripod, cat or dog.
Why do some vets do things that way?
So many people don't realize that their dogs are in pain.
He's a three-legged dog and he's still pretty good.
Welcome back to Tripawd Talk Radio. This is episode number 120, and we're talking all about integrative veterinary medicine. What is it? What treatments are used, and what conditions do they address? And how can these alternatives to Western medicine help our three-legged friends, especially when it comes to a cancer diagnosis? Well, we had the honor of chatting with Dr. Henry Pasternak, who answers all these questions and more. Dr. Pasternak has been practicing integrative veterinary medicine for more than 34 years. He was first certified in veterinary acupuncture in 1989, and he's been keeping current with holistic treatments ever since. He even wrote the book on the subject in Healing Pets with Nature's Miracle Cures, which discusses in great detail how holistic and conventional medicine can work together effectively. We talk about how acupuncture helps dogs with arthritis and the importance of nutrition and herbs to both heal and help prevent disease. With many tripods diagnosed with some form of cancer, we spend a lot of time discussing immunity. And we talk about other holistic approaches, including fecal transplants and ozone treatment. Yeah, we cover a lot of fascinating stuff here. So, on with the show. Dr. Pasternak, welcome. Thank you for joining us today.
Oh, great to be here.
Hi, Dr. Pasternak. I am so excited to meet you. I've heard such great things about you.
Thank you. Glad to be here.
Well, can you tell us a little bit about yourself and why you decided to focus on integrative veterinary medicine?
I'd love to start with just knowing what integrative medicine is. Some listeners may not know. So what is integrative veterinary care?
Sure. And it's basically integrative medicine, whether a human doctor or veterinary doctor. And it's integrating both Western medicine together with the Eastern philosophy of various natural approaches to diseases and health, and try to prevent diseases for the most part, because you're limited with just the Western forms of treatments. Many times there is no treatments, or the treatments are sometimes maybe worse than the disease itself and don't work anyway. So it's good to be integrative, where you can have the best of both worlds.
And Western being traditional, like prescribe medication, and Eastern being more alternative, quote unquote.
More, and many times, if you have an infection, sure, you're going to want to use an antibiotic in the acute situations. The Western treatments seem to work really well. And the Eastern, or the holistic aspect, is to try to prevent diseases long term, and work along long term, so that not only prevent diseases, but you can actually treat many diseases long term holistically as well.
Was there a certain patient or a situation that got you interested in this type of medicine? Because you come from a traditional background. Why did you decide to get into this type of practice?
Well, pretty much all veterinarians come from a traditional Western background, because that's all they pretty much teach in veterinary school. Well, a few years in, I graduated from the University of Missouri, 1986, and after a few years doing strictly Western medicine, I enrolled in an acupuncture course, International Veterinary Acupuncture Society, and started with the acupuncture and the getting more involved with herbs and nutrition and a lot of other holistic oriented approaches to medicine. And I find it, and a lot of people actually expect that when they come to see me, because when they come to see me, they've already been through a lot of Western treatments. And every day, probably half my clients that I see are brand new clients that have been through a lot of Western treatments for various diseases. It could be a disc problem or cancer or chronic infections and so forth. And I try to integrate, if I need to use the Western medicine, I'll do that too, or try to integrate other things, nutrition, herbs, and other aspects of natural medicines. In fact, some are not even called natural anymore. They're using in mainstream medicine such as fecal transplants, which they're starting to do more in humans for cancers, where they used to use it just for really bad colitis, where they could not, where people were going to die of bacterial infections, and they use that and save their lives as one aspect of it. And that's one thing of many things. So it's good to know. You make sure you get a good diagnosis of what the problem is. You rely on X-rays, ultrasounds, MRIs, CAT scans, whatever it is, to get a good diagnosis to see which is the best approach to integrate things in, and what are the things to work in the acute situations, which are many times could be a Western drug of some sort, and or other herbs for long term. And nutrition, of course, is really important as well.
That is a really forward-thinking approach that you started doing a long time ago. I mean, there were hardly any vets out there like you doing this way back. What made you decide to do it? Because there were, like I said, we never even heard of acupuncture for animals until, I don't know.
Well, until Jerry needed it.
Yeah, until our dog needed it. And that was 07, 08. But even back then, it was pretty rare.
Yeah, and I took the acupuncture course in 1989.
Wow.
So it was way back then, but they were actually doing it, I think, in the 1970s, and it got more and more popular. But there's a lot of other things, and I do acupuncture probably every day on various problems. Most of the time, they come in for disc or things related to arthritis, whether it's a disc problem, arthritis in the elbows or hips or knees, whatever. And I've also done it for animals that have seizure problems too. So I use it for those problems. I usually don't use it as much for cancers unless somebody wants me to do it. But so I usually use it for the arthritis and neurologic problems, whether in the back and or in the brain, things like that. So I will add that to that for that, and along with other aspects of whatever else I'll add to it holistically.
I love that you're giving people different treatment choices for their animals, because it just seems like, you feel limited, we feel limited, and there seems to be so little we can do when we go home with a bottle of medication. But being able to have other choices to approach disease is really nice. And I'm wondering, why is it that there's still a lot of skepticism in the veterinary community about integrative medicine?
Well, it's hard to the scientific community. They don't spend a lot of time, or a lot of money, I should say, with a lot of these treatments, because you can't patent them. You can't patent herbs. Mm-hmm. And so it's very difficult. So unless you have, but remember, a lot of the Western drugs that we use too were not okayed, didn't even go through the FDA for dogs. A lot of the antibiotics were okayed for humans, and not for dogs. Some of the there's drugs for nausea and other drugs that were not. They were mainly used in humans, and then they use it on animals, off-label. So there's a lot, and pretty much most of the cancer drugs are all off-label. They're for humans, and people just anecdotally use them in animals, in dogs and cats. So, but I think it's becoming more and more popular because people are asking more of it. Today, I had an owner with a dachshund came in today for acupuncture, because the dachshund has a little pain problem in the back and a little disc problem there, that she went to veterinarian a couple of times, and some of the drug. They just took some X-rays, and dog didn't like the side effects the dog had on the drugs, and so we did acupuncture on the dog and integrated some herbs for the dogs too that will not have side effects as well, and it may help also.
So you've mentioned acupuncture and herbs a couple of times. Are there other common holistic treatments that you're providing, and what conditions do these address?
Yeah, so I do fecal transplants as one thing that I add, and nutrition. And fecal transplants I do for a lot of different things, such as chronic infections for the immune related. I'll also add it to cancers to help boost the immune system. The microbiome is really important, and they actually recently in last year or so added it for humans for cancers. But I also use it for. I've had a lot of dogs that, for example, had chronic allergies and chronic skin infections that no antibiotic worked for, and they were resistant. They had MRSA, staph bacteria. They were resistant to all antibiotics, and 85 to 90% of those dogs got better integrating herbs, nutrition, and fecal transplants as well. So I added that. I also do. Many times I'll do rectal ozone treatments, and that I pretty much use it only for mainly for cancers. Though I've heard one veterinarian says she uses it for a lot of other things too, for arthritis and many other things. But I pretty much use that for cancers, rectal ozone. So and then along with with nutrition, which I feel is really important as well, to get the, for example, if they're if they have cancers, they should not have any carbohydrates or very minimal. Of course, get them off of all the grains and rice and beans and everything else that they're, and mainly more of a ketogenic type diet of meats and fats, organ meats and so forth. Some people also, even for cancers, will even maybe do some intermittent fasting where they'll have a window of eating, a 6-hour feeding, and maybe an 18-hour fast, because many times when you feed the animal, you also feed the cancer as well. So an intermittent fasting of 6 hours on, 18 hours off, maybe also opportunistic to some animals, depending how, if it doesn't stress them out. Some if they're stressed out, then, spread out a little bit. But so we do a lot of that too, and along with whatever herbs. And sometimes I'll use some off-label type drugs, such as one drug that I've used in the past couple of years is called rapamycin, and it downregulates mTOR and upregulates autophagy. So, and rapamycin I use for a lot of different diseases. And the reason it works in so many diseases is that many diseases have a similar basic problem of inflammation, and they create a lot of these what some people call garbage or zombie cells and other senescent type cells, and rapamycin stimulates autophagy to get rid of these bad cells that should have been gotten out a long time ago. And this is human or animal. All living organisms pretty much have this mTOR, which they discovered through rapamycin, which is an extract from a certain Streptomyces bacteria that is discovered in the 1960s on Easter Island, the only place in the whole world. And then they started doing more and more research on it and found out that, wow, there's something unique about it. And because of rapamycin back in the 90s, they discovered that this mTOR pathway, now under normal, healthy situation, person or an animal, it's in balance with the other metabolic pathways. But when it's off balance, it gets overregulated. So rapamycin downregulates it. It doesn't get rid of it. You can't get rid of it. You die if you did, but it downregulates it to a more normal level and upregulates autophagy to just get rid of these garbage cells and proteins in the body. And I think rapamycin, some people feel it also has like a restrictive, some calorie restrictive type behavior too. So downregulating it, because many diseases will have an upregulation of the mTOR, and such as cancers, autoimmune diseases, heart diseases, many other inflammatory diseases in the brain or spinal cord, autoimmune diseases. So many diseases, diabetes, another one. And that's one reason metformin may work in humans, because it downregulates the mTOR. But metformin also has side effects, which really, rapamycin is really the gold standard for health span and lifespan, with really no, people really have not seen any side effects of it when they use it accordingly. So many of the researchers that do research on rapamycin take it themselves. Usually they'll take it once a week themselves, because they see a lot of upside to it with no negative side. It's also an immune modulator as well. It actually was okay for several cancers in humans too, I think recently. So rapamycin is sort of not totally a magic bullet, but it's as close as you can get to it. And you, along with other aspects, I think it has a large upside to it. So I use it in a lot of different diseases, cancers, and many other degenerative diseases as well.
So that's fascinating. I'm also familiar with acupuncture for orthopedic issues, but what other conditions might acupuncture be applied?
Any arthritis. I use it in a lot of back, disc, degenerative problems there to help the energy flow, and had quite interesting experiences. Animals that I thought would never walk, and it's pretty amazing. And I see that all the time. I've had animals that people decided not to have surgery on, back surgery, and went to this, and the surgeon would say, well, if you don't do surgery, then you might as well put the animal to sleep, because the dog will never walk again. And within X amount of time, sometimes a few days or a few weeks, the dog starts walking without the surgery. And of course, it's very expensive. MRIs alone can run somewhere around $5,000, and surgery, back surgery alone, can run at least $10,000, and with hospitalization and other things can run $15,000 or more. And this is non-invasive, along with whatever other things, modalities I'll use with the acupuncture. Relatively inexpensive, and most of the time it does help.
So neat. That is so neat. We have a lot of members who need help with mobility, and acupuncture could do a lot for them. But the reason people come to us usually is because of cancer, and their pet has lost a leg to some type of limb cancer, soft tissue.
Yeah, bone cancer. Yes.
Yeah, or bone cancer. So I'm curious, are the approaches that you use different for different types of limb cancers, and if so, how do they differ?
Well, if there's bone, the most painful thing in veterinary medicine is bone cancer. It is the most painful thing anywhere, more painful than a broken leg. It is the most inflammatory thing. So for those dogs with bone cancer, to get rid of the pain, they have to amputate the leg. There's no way around that. What they have to try to hopefully, and dogs will do well on 3 legs. They'll do well on 3 legs. What we have to do is build up the dog, the immune system with various modalities, and to help prevent metastasis to the chest and other areas. And dogs will be happy without the pain. And most dogs do very well on 3 legs. They'll be happy. They'll still eat well. And so forth and so on. So we'll do whatever other various things. We'll add herbs and of course the nutrition, and many times we'll do fecal transplants and rectal ozone treatments and a variety of things like that. So the holistic, pretty much the only Western treatment for that is the leg amputation. Though some people will opt for chemotherapy, and I've never recommended chemotherapy for that because I don't think it'll work, and I don't think it'll save anybody. And many dogs can get sick on chemotherapy as well. I do recommend chemotherapy and I have done it, a modified chemotherapy myself, for some cancers such as the lymphoma and the leukemia classes. It usually will help some for many of those. It may or may not cure them. It may help them initially and so forth. But so in those classes, it may help chemotherapy, but I don't recommend it for the bone cancers. You asked me about other cancers. For example, splenic hemangiosarcomas is another one. The sarcoma class of cancers tend to metastasize to far areas. Osteosarcoma, hemangiosarcoma, and other sarcomas tend to metastasize to the blood. And also they may also piggyback many times on the white blood cells and can metastasize that way as well. So, for example, in hemangiosarcoma, we rarely will take out the spleen because to the naked eye, you cannot tell. Statistically, 75% of the spleens that we take out are actually hemangiosarcoma, and 25% maybe just splenic cysts, but they all look the same to the naked eye. They all rupture, and you can die very quickly from either one. And then you send it off to the pathologist and hoping to get a splenic cyst, but the majority of the time you get a splenic hemangiosarcoma, and hope that whatever you'll do will extend the life. The average lifespan many times could be just several months, anywhere 2 to 4 months before metastasis comes from splenic hemangiosarcoma. But I've seen dogs live anywhere from 6 months to 3.5 years before they die of metastasis. But some dogs can die statistically after you remove the spleen. At least 25% of the dogs, 25 to 30% of them may die of sending a blood clot within a couple of weeks after you do the surgery. So you always have to warn people that may happen in the next couple of weeks. So it's a bad cancer, but you do the best you can, and so forth. So yeah.
Any type of cancer is it's so terrifying to people. And I think that being able to work with somebody like you helps us feel like we're doing something for our animal. And how many people do you see that look at what's required of them, whether it's, regular maintenance or fasting or supplements 10 times a day? Do you think people are shocked by the amount of work that it takes to do something like this?
Some are, and some opt to do it. The best thing to try to do is try to prevent diseases. And so when I see many dogs for whatever problem, assuming, let's say they come in for chronic skin infection and chronic allergies, I try to talk to them about also many of the raw food diets too, both frozen, freeze-dried, raw butter, of course. Many times when they come in with a puppy, I talk to them about trying to integrate into their regular, whatever conventional dog food with the raw food diets as a preventative. It doesn't have to necessarily be always 100%, and many dogs are going to be very big, and it could be very expensive. But if they can do 50% of the diet as a raw food diets as a preventative, that may help them in the long run. And many of my clients have done that with chronic allergy and say, yeah, since I got the dog on the raw foods, My dog hasn't been as scratching as bad, and so forth and so on. And a lot of the conventional, they may go to a dermatologist who's been there and hasn't helped that much, and they give them a lamb diet or some other diet that doesn't that did not help them, or a low protein or a low protein type diet that's one protein. Those diets have not helped them either. So I think you need to build the immune system up, and that helps in the long run for a lot of diseases. You have to balance the immune system. The diet.
Yeah, and I love that you educate people about the importance of preventing cancer in the first place. And I can't let you go without mentioning you have a book available, right? That people can get.
Yeah, they can probably get it at Amazon.
Okay.
It's called Healing Pets with Nature's Natural Cures. It looks something like this. So
nice. That looks like a big book.
Probably can get. Yeah, and I self-published it in 2001. But they may still be able to get copies at Amazon. Very good. Talks a lot of herbs in there, and talks about raw meats and the raw food diets, and so it's very good. It's a good starting book. Yes.
I think so. We should all be so lucky to have somebody like you nearby. Do you do any long distance consulting?
Sometimes I do. Sometimes people will call me and we do that. Yes.
But aside from the book, it looks like you have a vast amount of resources and information on your website. So we'll be sure to point listeners there as well.
Yeah. And I just, I want to say thank you so much for being here. We appreciate this, and we'll get the word out to our community that you're out there and that this is an option if you're looking at different ways to help your dog or your cat fight disease.
Yes. I'll be happy to.
Thank you. Thank you, Dr. Pasternak.
Thanks,
You're welcome. You're welcome. Have a great day.
And there you have it. Integrative veterinary medicine. Fascinating stuff indeed. Many thanks for everything the good doctor is doing to blend holistic treatment with traditional Western medicine at Paternak Veterinary Center in West Los Angeles, California. If you're in the area, check out the clinic. And if you have any interest in holistic treatment for your pets, check out their many resources at PasternakVetCenter.com. As always, we'd love to hear about your pet's holistic treatments or any questions you might have. So send us a message or join the discussion at Tripawds.com.
He's a three-legged dog and he's still pretty good.
Thank you for tuning in. Subscribe to Tripawd Talk Radio for more pet amputation tips from experts, and claim your free gift just for listeners at downloads.tripawds.com/podcast.